Okay, guys, so I wanted to go over a computer system that you would see in a dental office. This one is called Dentrix. It is I would say the most popular one you may see out there. There are others. There's PracticeWorks. There's, so many other different ones, but this is just one. And this is, I'll show you around a couple things, but it has kind of a basic picture here, and everything you can click on it. So you have like the time clock here. So this is where you could punch in and punch out for the day, and it does your time. Your lab assignments. So when you make a lab script for the lab, it would be here. Your patient files are going to be here. So like their insurance names, their demographic information, how much they owe us or don't owe us, whatever. Then you have the phone as your treatment plan manager. So that's how you're going to put in the information that they need and print it out in a form called a treatment plan that shows them how much each step is going to be, what their insurance is going to pay, and all of that information. Here's where you're going to get to the schedule. We'll spend most of our time in there today. And then this is called their ledger, which kind of is, if you've ever done, if you did a checkbook back in the day, you kind of kept a running list of all the things that you purchased and didn't purchase. Today it's electronic, so when you go to your bank statements, you can see what you paid for, what money came in, what money came out, all of that. So it's the same sort of thing, but for their account with us. This is going to be, how you can look up patients, a general calculator to figure out stuff. This is going to be any questionnaires that you want to print out for your patients and do stuff. This is called your office manager stuff. This is where you can print out reports. So if you want to print out a report of, let's say a patient canceled today and we have an opening for a patient for cleaning, I can go and print a report here showing all the patients who need a cleaning, and then I can call off of that list. So you can pull reports. There's so many different types of reports out there. So that's just one thing you can use. And then the filing cabinet is your document center. So when we scan something that the patient signed and showed them, it would be kept here. So this is just one way you can look at it. I personally really like the schedule, so we'll click on the schedule and we'll open that up so that you guys can see it or not. Oh, that's already down here. Okay, so this is the schedule. Okay, now the reason that I love Dentrix, this is by far my favorite thing, is that all of those things that I just told you about are all up here at the top. So I can get to all of them by just clicking one of these things, so a lot of other systems you would have to click out of this, then go back here, then go into this, and then click out of this, and then come back here, and then click into it. So there's a lot of other systems who do it that way. Dentrix is just really, really great because it has everything available for you in these little shortcuts up here. So you can click in and out of it as much as you need to, okay? Now, this is a blank schedule, so you'll see that there is nobody on here. If you scroll through, it's pretty blank, right? Now the dark areas are times that we are not open. The yellow areas are time that we are open. Obviously from 12 to 1 is when we are doing our lunch, and then we end our day at 5 o'clock. So you can adjust all of this. All of this is done in the settings. But you have the time over here on the left, and then you also have the time on the right here, so you can see what time it is. And these are in 10-minute intervals, so you'll see every line is 10 minutes. All right, and it is on both sides here. Okay, now this has 3 columns. In the columns in the dental field mean chairs. Okay, so if I have 3 columns, that means I have 3 dental chairs. So one of them is going to be hygiene, this is going to be doctor, and this is going to be doctor. The reason that the doctor has 2 is because the doctor has dental assistants. So when he is seeing one patient and the dental assistant can do something that he doesn't have to do, he's going to leave that that room and go somewhere else, and he's going to try and go back and forth between patients, and make you make more money that way, and you also can see more patients that way. So usually you have 2 assistants per doctor. Some offices have 3 assistants, some of them have circulating assistants, all kinds of stuff, but generally it's 2 assistants per doctor. So that's why you have 2 columns. All right, now some offices will say this is, my assistant number 1's column, and this is assistant number 2 column. Other offices say you guys get patients and share patients no matter what column it's in, but it really depends. It just means these 2 are doctor's chairs that can do doctor procedures, and this would be a hygiene column. Now you can have more than 1 doctor, and you would have like 5 columns in here, or you could have 10 columns in here, and that's all in the settings on how much you want to set up your office to be that way. But generally speaking, the column equals a chair that a patient can sit in. If I had 2 chairs and 3 columns, then that means, somebody's going to be sitting out. Somebody's going to be waiting. We don't want to do that. So you have a column per chair. Okay. Now let's talk about how to schedule a new patient. So one thing you can do is just double click at a time. Let's say that this patient wants to come in at 4 o'clock. So you can double click, and an appointment will pop up, and it'll ask you for some information, and it looks like I double clicked too much. There we go. Okay, so you can search for a patient, right? So let's say that oh, that's cute. The tooth fairy called and needs an appointment. I could look her up, so you can go up here. I mean, obviously our office would have more than 2 patients, so you would go up here to her last name, and then you would type in fairy. Okay, and then hit search, and then it'll come up with all the people with tooth fairy. So you can just double click on that, and now we've chosen this patient. You can see the patient's name up here. This is her appointment box. This is all the information for the appointment. Now it looks like a lot, but I promise you it's much, much easier than you think. Okay, so the first thing I want you to know is that the patient's name is up here, so you know that you're scheduling the right patient. The next thing down is called the provider. The provider is the doctor or the hygienist. They're the only 2 doctors the providers in the office, and what that means is that they can provide a service for the patient. Now we do that too. We provide services, but everything we do is underneath the doctor's license. It's not underneath us. So the hygienist has a license to be a hygienist, so they are a provider. According to insurance, they are a provider, and a dentist is a provider, and that's it. Okay, so when we're scheduling someone on our schedule, we need to know who we're scheduling it with. Am I scheduling it with the doctor, or am I scheduling it with the hygienist? So that's where you're going to choose the provider and choose who you are going to be seeing that day. So let's say this is, Dr. Doe, and we're going to choose him. And then if you have an additional provider, so like if this was, let's say that they're going to get a cleaning and an exam. The exam is done by the doctor, but the cleaning is done by the hygienist. So that's why you have 2 spots for providers. So if you needed to have 2, you could in that situation, but most of the time you're just going to have 1. Okay? Now, this box here is where you're going to put the treatment that they're going to use here. Now, we have codes in the dental field, so everything we do has a code attached to it so that we can, we know exactly what procedure was completed. So, like an exam is D150, a periodic exam is D120, limited exam has a code, a regular cleaning has a code, a deep cleaning has a code, x-rays have a code. Everything we do has a code associated with it. So what we're going to do is we're going to find a code associated with it. Now, this is a patient we've already seen. Remember, she was in our system already. So we've already seen her. She's already a patient. So if, let's say I saw this patient, and last time we saw her, we said, hey, you really need to do a root canal on this tooth. I'm going to put that in the system on that day so that when she comes back today and she called me today and wants to schedule, that's what I'm doing right now, is scheduling her on, putting her on my schedule. I'm going to look up the treatment we've already talked to her about. So that's going to be under TX, which is treatment. So I click on here, and this is all the treatment we've already discussed with her, right? So it looks like she needs some extractions done, which is fine. So let's say that she's on the phone with me right now, and she needs an extraction done. On the lower left, she said, I got to get that tooth out. I got to do it. So I know the lower left is number 17, right? So I'm going to go ahead and choose that one and hit close. So you'll see that it automatically puts the code in there of what we need. And then the description is in there as well. Okay. Now, it's also going to automatically populate for a time. So this a length of time is 30 minutes. You can add more time if you want. So I would say generally an extraction you want to schedule is for an hour. So we'll add some time. So it's 60 minutes now. Down here is where you're going to write some notes. So what most offices do is they enter a date line showing when we're writing the notes. And then you can put, let's say the patient told me on the phone that she's nervous, right? I'm going to put patient is nervous, and then I'm going to put my initials showing that I'm the one writing the initials on there. Okay, so that way when the patient does come in, I can look at these notes and say, oh, okay, I know this patient is nervous. So when I see this patient, when she comes in, what I'm going to do is I'm going to say, hey, Tooth Fairy, I know you're nervous about today. Don't you worry. We're going to take great care of you. We're going to try and put her at ease. You can also put in there, patient is furious about the amount, wants to talk to the doctor. Patient doesn't like needles. You can put patient has no-showed several times. You can put a lot of different notes in there that really, really help us. So you'll want to put notes and then your initials so that we know who wrote the notes and when. Okay. For now, that's really, I'll show you some more things in a little while, but for now, this is pretty much everything we need to schedule the appointment. So what I'm going to do is I'm going to click OK. And you'll see she now has an appointment, and it comes up already as her name, the extraction we're doing, and the tooth number, and her phone number. So let's say her appointment's at 4. Let's say it's about 4:15 and she still has not shown up yet. I need to call her and find out where she is. So what you're going to do is you'll see her number here. You can hover above it, and then a box will pop up with more information. So you'll see how she has 2 numbers now. Right, so you can see that, but that way you don't have to go searching for the information, right? It's right there, and it's easy to see throughout your day. Okay, so again, this is a patient that has already been seen by us, has already had a treatment plan. We've already seen her. Well, let's say that a new patient calls and says, oh, I'm a new patient and I would like to be seen, to get a cleaning, and whatever. So you're going to double click at what time you want to schedule them, and instead of searching for them, because they're not going to be in here because they are a new patient. They aren't in our system until we put them in there. What I'm going to choose is new patient here. And then now I'm going to have to input their information. So you're going to type in their last name. You're going to type in their first name. You do not have to fill in all of this. You can just type in a little bit if you want. I personally like to get their phone number and their name, and that's really about it. And then down here it says referred by. This is really important in a lot of offices because this is how we know what advertisements are working. Some doctors use, ads on TV. Then some of them send out postcards. You get postcards in the mail that say, oh, we're doing a special on cleanings or specials on exams. Some people do it in like the Mint magazine. Or Google, you pay to be on Google. You pay to be number 1 on Google. If you want to be, when you search dentist in my area and you want to be number 1, those people are paying for that spot to be on number 1. So you want to make sure that we know what is working and what isn't working. So when you click that, you can see if another patient referred him, or you can click OK. And this is where you're going to list all the marketing that your office is doing. So you're going to put Mint Magazine, Google. You're going to put all of those things here so that you can keep track of it. And then you can, print out a report and know what type of marketing is working and what isn't. Okay, so that's why a lot of people say, oh, how did you hear about us? Because we're trying to keep a rapport going. Okay, so you're going to type in, all this, and you're going to hit OK. Oh, put too many. Here we go. All right, so now that we've put their information in, you'll see that their name is going to pop up here, but the difference is between earlier and now is that it still says new patient next to it. Because right now, this patient's still on the phone and scheduling the appointment with me. They have not come into the office, so they really aren't a patient of ours until they come into the office. So for right now, they are a new patient. Until they walk in the door, they will remain a new patient. Okay, so from here, we're going to do the same thing we did earlier. We're going to say, who do we want to schedule with? So we'll schedule with this doctor again. What treatment are we going to do? Now you'll see that this TX is not available anymore. And remember, the patient we scheduled earlier had treatment already, had been seen. This is a new patient. We've never seen them. So we're going to schedule them for an exam. Okay, so you're going to hit initial, and this is going to come up with all of the, the appointments that you're going to use right away and you don't need to have a treatment plan for. For like a prophy is a cleaning, so you're going to do those, constantly all the time. So it's just easy, quick buttons to get through. Think of it kind of like your desktop. Instead of having to go search through all your documents, you put something on your desktop so that it's easy to get to because you use it often. That's the same thing here. So you're going to just have this list of procedures here so that you can get to them quickly. So for her, we're going to do a comprehensive evaluation. You have to do that with every new patient. And then we'll do an FMX, which is a full mouth of x-rays. And then let's say she wanted a cleaning, so we'll say we're going to do a cleaning. So for this patient who just called us, we're going to do a cleaning, we're going to do some x-rays, and then we're going to do the exam as well. So that's what she's scheduling for. And again, it automatically came up with the length of time, of 80 minutes, which is fine. And then I'm going to add some notes in here, and I'm going to put, let's say this patient has no insurance. So while I'm on the phone with this patient, if she doesn't have insurance, I'm going to say, okay, there's no insurance. Well, we have a special going on, and we can do a, let's say, a $99 exam, right? And then, again, put your initials behind it. So you're going to kind of notate what you talked about on the phone with them, that they have no insurance, and that they are okay with a $99 exam that we have a special on right now. So these are, again, just notes for you guys when they come in. So I highly suggest that you make as many notes as possible on any little thing that you think is, needed. And then you're going to hit OK. Now, let's look at the difference here. The difference is this says NP and then the patient's name, and this just says their name. NP means new patient. This patient is not a patient of ours until they come in the door. So even if I go into, their chart and things, they don't really have a chart until I make them a patient. So they're just on the schedule for right now. Okay. So, let's say that this patient comes into the office and they're filling out paperwork. What I need to do is to make them an appointment. So what you're going to do is you're going to click it and you're going to hit, where's it at? Oh, file. You're going to hit file, and then you're going to choose, where's it at? This one's a little different than the others that I've used. Okay, so we're going to go to the family file. That's probably the easiest way to do it. So again, these are just different things to go into there. So the family file is the one with the folder and then the two people in front of it. So the family file, if you look at it, it's going to be their name, address, phone number, when their last appointment was, their birthday, the insurance information goes here. If they have any family members that go here, they would be listed here. Any patient notes, who referred them, a lot of information is here. So this is, where you can find all of that. Now, this patient, you notice, is blank because we have not made them an actual patient yet. Over the phone, all I did was get their phone number and their name. But now that they filled out paperwork, I can get their paperwork and I can fill in all this information. So first I need to make them a patient. So you're going to go to File and go to New Patient with an Appointment. All right. Now this, if let's say that this person coming in has like their daughter goes here, you're going to create a family file. So you're going to go in and find her daughter and then attach them. So let's do that. We'll attach them to this person here. So you're going to click on her and then put in her information. So you're going to put in first name, last name, are they male? Are they a non-active patient? Patient is anyone that's being seen. Non-patient is like if you brought your daughter in, but you're not being seen, but you're paying for your daughter, or your insurance is your daughter's under your insurance. So we have to have you as on file, but not as a patient. So that's what non-patient is. Inactive is anyone who has not been seen in 3 years. So they'll turn inactive after a few years. You're going to put the birth date in, their social, driver's license, their address, email address, and any phone numbers that you have here. And then you're going to click OK. Oh, I guess I have to put a birthday in there. That's okay. But what you're going to see here is that I made the, they now have information listed in here. The phone number I put in there, their name, but down here you're going to see that I have 2 people, right? So now you can see that this patient is attached to the tooth fairy because they are part of the family. So if I want to see the tooth fairy, all I have to do is double click and now I'm seeing her information. If I want to see this patient's information, I double click on it. So that's what the family file is it kind of attaches them and kind of groups them together as a family. So now if I want to go back to the appointment book, you'll see there's a tooth here which takes you to the chart. This is the ledger, and then there's an appointment book. It's a red book. So if I click that, it takes me right back here. And now you'll see the NP is gone because this is an actual patient now. They have a name. They're in our system. They are, being seen. Okay. So let's go into the chart. Okay. So if I want to go into her chart, I'm going to click this and then click the tooth. That is the patient's chart. All right, so this is the chart. I really love this view because I can do a lot of different things. There's a lot of different sections to this, but there's a lot of different views that you can look at this chart. This is the treatment plan part of it. This is the notes part of it. And this is the codes that we were talking about. So if I wanted to take some of these away, I could. So you could look at it in... Excuse me. Come on. There's a presentation so we can just see the teeth. And you can kind of show them and draw on it. And, this is really good when you're explaining to a patient, like, this tooth is priority right now. And then we're going to do this tooth is number 2. This tooth is number 3. And you can kind of discuss why we need to take, this chip right here and all that. Like, you can draw all over this, and it's really good to present for the patients. So if you want to do that, you can do that. And then, let's see. Come on. It's taking a while to load. All right, so then there's another view where you can have the mouth set up here. You can open their mouth and, chart it that way. You can also look at it in an arch view, which is kind of like what we use for your tooth quizzes and stuff. So there's a lot of different ways to look at this. And then you can use it as a work chart where you don't need the treatment plan and you just use this. You can also use a full screen. You can also do just the progress notes, or you can do the one that has a little bit of everything, which is the one that I personally like because it has, I don't have to click in and out of things constantly. And this is really helpful for me. Okay. Now you'll see that this looks sort of like the charting that we've been discussing a little bit. So you'll see that there's 3 sections. Again, these are just 3 different views to look at it. These are the maxillary teeth, these are the mandibular teeth, and they even have numbers on there for you, so that typically helps you. Over here are all of the codes, and these are the progress notes, and we'll talk about that. If you go to clinical notes here, this is where you're going to write your notes. Patient presents for such and such. Patient has a cavity on number 2. We need to do a filling for this, this, and this. You're going to write all of that down here. So this is, I could spend hours going in here and showing you each one of these things and stuff like that, but you're going to get a chance to play with all of this when you get back to the campus so that we can, do a little bit of this every day, and you'll be able to use all of these different things, and I can show you what all these different buttons do, and, quick ways to do things and little cheat sheets that I have and things like that. But generally this is just the chart where you can see things. If I'm going to chart a tooth, I can do that here. So you'll see things too that are charted on here so you can see everything. But this is what this looks like, and this is how to use the chart. Now, if I want to go back to the schedule, again, you'll see the appointment book up here, so I can go right back to the appointment book, and I can see everything here. But this is really, really nice. Another thing you want to look at is the ledger, which is the piece of paper with stuff listed on it. This is going to list all the things that we've done for this patient and things that we haven't done. So for this, let's say that we completed this extraction. You can right click it and hit complete, and it'll turn gray, meaning that this patient is left. We've completed everything for this patient. It's all done. So now when I go to their ledger, you'll see it'll have number 17 extracted on this date. It's a running list of things that we've done for this patient. So that's what the ledger is, and it tells you how much they owe and all of that fun stuff. So this has a 0 amount, but we would hook them up to an actual amount and things like that. So this is just generally how to use this, and what it looks like to use an online schedule, and how you can get into different areas into the actual chart and the patient and all that. Again, I could spend hours going through this with you guys, but I want to give you just a general idea about it, and then when you come back to class, we're going to spend a lot of time playing with it and getting to know this a little bit better. If you have any questions, just let me know. Otherwise, have a good day.